anyone who's worried they've contracted measles is being told to call Healthline after several new locations of interest were identified. Health New Zealand says vaccination rates simply remain too low to ensure community-wide protection against the virus. So, could we be staring down the barrel of a serious outbreak as we all get together over this summer period? Anna Howe is a Canterbury epidemiologist and she is with us now. Good morning to you. How concerned are you that we now have so many hotspots or areas of interest in so many different areas of the country?
Morning, and Nadine. Yeah, we're always quite concerned that this happens. So, you had mentioned, the spottiness of coverage is the concern, and so the fact that we don't just have these broad areas, but also the fact that some of these events were actually, close contact events with lots of people, and that's really particularly concerning.
Because some of them were bars on K Road where people get really close together. So how likely is it, given how contagious this is and our low vaccination rates, that could really set off a lot of other infections?
Yeah, so I think most people are aware now that measles is one of our most contagious infections. And so the coverage, though, is talking generally about our 24-month-olds, so our small our pepe and tamariki. But the events like the bar and the concert, that's more about our rangatahi or our young people. And we probably don't have a good gauge about what their coverage is. So being up close and personal and having people there with a really infectious disease is very unhelpful.
Well, and summer brings with it a lot of events like that. Everyone's cuddling over Christmas, people are going to festivals over the new year. Does that make conditions ripe for a lot more cases?
I think it is particularly concerning. I mean, we're always concerned when we even have one case of measles. So I think we just need people to be hypervigilant. So if they haven't already gone and checked their immunisation status with their healthcare provider or something like their health book, then they should have that conversation. Or actually, as long as you're not pregnant or immunocompromised, you can get vaccinated. And so I know a lot of people have actually just gone out and got what might have been a third dose, because at least then they know that they're protected. And lots of people are concerned about those family events and that it brings together lots of our vulnerable members of our communities. And so some of those can't actually be vaccinated. And so this is not just about protecting you, but about protecting your loved ones as well.
If people have gone out and got third doses, then should we avoid getting too excited about the fact that vaccination rates are rising, because it could be people who were already okay rather than people who weren't protected?
So I can understand why you might think that. But actually our vaccination coverage, when it gets reported, is again for the 24-month-olds. And so that's not a measure of our entire population. And we also know that there are certain segments of our population where the coverage has historically been low. So we want to target those people, and Te Whatu Ora has made an effort in the past since the 2019 outbreak to target those specific groups. But in terms of our coverage rates, we still really need our pepe and tamariki to be immunised. And so there's an incredible amount of work happening in that space by Te Whatu Ora, but also lots of our really awesome healthcare providers, including Plunkett, who, and a lot of them are taking a life course approach to this as well. So they're looking after the entire whānau when they come in.
Yeah, well, that's positive news. Here's hoping that we don't see too many more cases over the summer. Thank you, Anna. Anna Howe, Canterbury epidemiologist.